Hi, I'm Jeff Hoyt, Editor-in-Chief for SeniorLiving.org. To get the most out of Medicare, knowledge is power. Do you know the difference between original Medicare and what's available through Medicare Advantage plans? Well, Sharrese Sanders certainly does, and she wants to help you make the right decision about your health care. In this Zoom interview, conducted right before the annual enrollment period, the Director of Quality at Medicare brokerage QuoteManage will explain what's new in Medicare for 2023, how Medicare Advantage plans differ from original Medicare, what non-health benefits could be available to you, what's new in Medicare Advantage plans, and how to learn more about your options before it's too late. Hey everyone, it's Jeff Hoyt, Editor-in-Chief for SeniorLiving.org. Today I have the pleasure of speaking with Sharrese Sanders. She's helped us out talking about Medicare before. She's the Director of Quality for QuoteManage, which is a Medicare brokerage. And she's going to tell us what's going to be happening next year with Medicare in 2023. So welcome, Sharrese.
Hi, Jeff. Thanks for having me.
Thanks for taking the time. So 2023 Medicare, what's new, what's different?
Exciting things are happening for 2023. The costs for original Medicare, they can change each year. So, for example, in 2022, the Part B medical premium, it was $170.10 per month. That is actually going to decrease to $164.90 a month. There's also the Part A hospital deductible. Now, the change here is that there's going to be an increase. For this year, it's $1,556, but for 2023, it's going to be $1,600. But the major changes are going to be in the world of Medicare Advantage plans, just like the ones that we offer.
So Medicare versus Medicare Advantage, how do the plans differ from like original Medicare?
That's a great question. So Original Medicare is a federal program. It's administered by the Centers for Medicare and Medicaid Services, while actually it's private insurance companies in cooperation with the government that offer Medicare Advantage plans. So one of the things I like to explain to people is that Original Medicare, it includes very little to no coverage at all when it comes to some of the most wanted benefits that are actually available in Medicare Advantage plan. That can be some of the extra benefits like dental, vision, hearing, even acupuncture, chiropractic care, transportation, and even more.
Transportation, like driving you to the hospital or driving you to the grocery store?
Driving you to the hospital is included on most of these plans as well for an emergency, but this transportation refers to non-emergency health locations like maybe your doctor's office, the pharmacy, sometimes even to your local gym or your community center, the bank, or yes, even the grocery store, depending on the plan. So most of the Medicare Advantage plans that we offer, they do include some non-medical benefits at no additional costs.
Wow, that's good to know. So original Medicare doesn't offer that, but Medicare Advantage plans, some of them can offer things that are not medical, like driving to the grocery store.
Absolutely. It could be transportation, it could be a gym membership, a fitness class, Meals on Wheels. Something I really like, and I think everyone else is going to enjoy as well, is pet allowances. So members that we help to enroll, they could receive up to $300 a year for veterinary visits, food, clothes, and toys for their pets.
Wow, I was going to make a vet appointment today for my dog. That's good to know. Well, let's get back to human health for a second. You mentioned dental, vision, hearing, that those could be part of a Medicare Advantage plan. So what other medical differences exist between original Medicare and Medicare Advantage plans?
So with Original Medicare, it actually does not have a maximum out-of-pocket feature in order to protect you from the uncapped 20% coinsurance that would be associated with physician services. Whereas a Medicare Advantage plan, it does include that maximum out-of-pocket protection. I call it like a safety net, so that if a major illness or injury occurs, you won't be left with astronomical bills. But if you only have original Medicare, you don't have that maximum out of pocket. So you could be left with some exorbitant costs.
Oh, really? Because I always thought like Medicare, you had sort of, health insurance from the government. But you're saying if you really want to cap those costs, you need a Medicare Advantage plan, not just original Medicare.
Absolutely. The original Medicare is really a really good foundation, but it's not going to include everything. It also does not include prescription drug coverage. So if the beneficiary or if you have Medicare and you do not elect prescription drug coverage when you first become eligible, not only are you left without drug coverage, but when you decide to get it later on, you could actually face a penalty for getting it late.
We talked about what's new in original Medicare for 2023. Premium going down a little, deductible going up. But what's new in Medicare Advantage plans for next year?
That's where it gets exciting. So there's new innovations that were carefully designed really to benefit especially Medicare recipients that have chronic health conditions, or maybe they have some challenges with socioeconomic issues. So one of the things that was announced recently is the Inflation Reduction Act. This just came out in August. And what that's going to do is limit copays for covered 30-day supply of insulin. We know how expensive insulin could be and how many people rely on that to live. It's going to be $35 all year long, and you do not have to meet a deductible first. That is a great innovation. They will also, or this will also include $0 vaccines for things like shingles, COVID, pneumonia, influenza. These are just some of the things that have come out recently. And as you can see, they address health issues as well as socioeconomic issues. And there's several others we could talk about as well.
There's some kind of card you were telling me about earlier that's going to help people.
Yes, there is a couple of different cards actually. So in response to feedback, what has happened is carriers or insurance carriers have now come up with these spending cards. And those spending cards, they can be used toward rent, toward utilities like gas, electric, internet, even the cell phone bill. And that card is also the same card that you could use to purchase healthy foods and over-the-counter supplies like vitamins or allergy medicines or personal hygiene products. So you kind of think of it as a single card, but it has many separate wallets that you'll be able to use for several different benefits. So that is going to be really popular for 2023.
And then, are there any of these features that you're most excited about for Medicare Advantage plans?
Oh boy, there's so many. But one of the things I would say is that the pandemic really exposed that there is a need for greater flexibility and accessibility to healthcare, medical and mental health care. So we represent some of the largest brands in Medicare, and they responded in a really large way. So there are some plans now where you can get in-home routine care from a primary care physician. They will literally come to your house. And the good news is you pay whatever you would normally pay if you just went into the doctor's office. And this includes behavioral health services that are also available 24/7 on many plans for people who might face challenges with, anxiety, depression, or PTSD.
So they'll come to your house like the old-fashioned home visit by a medical professional, and it'll cost exactly the same as if you went to their office?
Absolutely. Everything that's old is new again.
Well, good to know. Just to wrap things up, there seems to be a lot going on. So, i- are there, what do people really need to know about selecting a Medicare Advantage plan as opposed to just going with original Medicare?
Well, there's a lot of advantages to selecting these plans, and there's really no risk. So you can sign up for a plan and you can try it out. It is going to provide you with everything that original Medicare Part A and B offers, plus a whole lot more. So if you're just using your red, white, and blue Medicare card, it means that you could be missing out on a wealth of savings and benefits. So it's worth giving it a try.
Learn more about the plans that are available to them, because I'm sure they're different for people at different parts of the country, different states. How can they learn more about it from QuoteManage?
You could give us a call. We are available, and our phone number is 1-800-363-9200. We have licensed agents that will be available to walk you through the process from start to finish.
It's not going to cost you anything to call, so it's worth calling QuoteManage, find out more about Medicare Advantage plans. And if you call them, you don't like what you hear, you can always go with original Medicare if you choose to, correct?
That's correct. There is no obligation, but we'd be happy to help you.
Great. So really appreciate you helping us today, Sharrese. Thanks for all the information.
It's always a pleasure, Jeff. Thanks for having me.